Hello everyone, welcome back to the part 2 of INICET November 2025 recall. I am Dr. Pratyusha Chava from team MDS-CONQUER. Let us have a look at the question. 47-year-old diabetic woman presents with a 2 cm ulcer on the hard palate. Okay. The ulcer base shows black necrotic tissue and the surrounding mucosa appears swollen. She also reports of facial pain and nasal stuffiness. Which of the following is the most likely diagnosis? Okay. Now I got two variants of this question. Okay. Few of you told me that ma'am, necrotic ulcer, black necrotic ulcer on palate was given. Okay. So similar to what question I have presented here. And few of you told me that ma'am, ulcer was given on the palate, but then they told acute duration. Okay. So these two framings entirely changes the diagnosis that we are looking for. Okay. If the question was given with respect to a diabetic patient, most commonly having a necrotic ulcer on the palate, what is the condition that we have to think about? Yes, I told you. Very commonly on the palate, okay, involving the nasal mucosa as well as the nasal turbinate and some extending into the eye and sometimes into the cerebrum also is your rhinocerebral mucormycosis, which is the most common variant of mucormycosis, okay, where you have the blackish necrotic eschar that is present because of the destruction of the the nasal septum, okay, and it presents as a black necrotic ulcer also. So if that was the answer, yes, your answer will be mucormycosis, if that is the framing of the question. Now, if the examiner did not give all of this and if he has given a question where they said that yes, probably an old aged female presented with an ulcer on the palate secondary to some trauma, okay, and then they said that it is of acute duration, probably just 1 week, okay, the onset is only 1 week, okay, and heals by itself. If any clues similar to this is given, then your answer will go towards necrotizing xylometaplasia. Okay. So, I have given you both the options. Now, it's left up to you people to actually think and analyze what was asked in the question. If the question is related to a diabetic patient, yes, we see mucormycosis because of diabetic ketoacidosis, which is a complication of diabetes mellitus. Very commonly, you see mucormycosis. Okay. If it is not given and if you see just a necrotic ulcer of short duration, healing within a week, okay, acute duration secondary to trauma, then you can think about necrotizing xylometaplasia. So these are your two various question options. Based on that, analyze which was given and come to a correct diagnosis. Okay, that was about that question. Next question. 56-year-old man presented with non-healing ulceroproliferative lesion on the lateral border of his tongue. Okay. So, non-healing ulceroproliferative, definitely when we think about this term ulceroproliferative, what comes to our mind? Yes, it is a squamous cell carcinoma. Next line, yes, they have confirmed, biopsy is confirming that it is a squamous cell carcinoma. According to current staging systems, which of the following feature is considered the most significant prognostic indicator? Okay, so while discussing the TNM staging, we have discussed that if we have to come to a diagnosis about how long the patient is going to live, that is the prognosis. What is the answer? Yes, definitely it is the depth of invasion. Okay, so if you see site and site of the lesion does not define the prognosis. Presence of inflammatory infiltrate also does not define the prognosis. Degree of keratinization also does not define the prognosis. How much deep the ulcer is involving, the depth, definitely it's called as depth of invasion, right? It is the most important predictor of overall lymph node metastasis also and overall survival also. Okay. After that, secondary to that is the perineural spread. Okay, where if you see that along the tumor any nerves are involved, okay, so tumor cells tracking along the nerve, it indicates that the tumor is behaving very aggressively. Okay, so this is also not a criteria. When we do a biopsy, when we get a poorly differentiated, Okay, when we get this poorly differentiated, again the prognosis become very bad. Prognosis becomes bad. Okay, well differentiated prognosis is good. Poorly differentiated prognosis becomes very, very bad. So among all the given options, I think the best one is either the thickness of the tumor or the depth of invasion. I think this is clear. Yes. So just now we were discussing about TNM staging. I told you TNM staging specifically for oral carcinoma, definitely you can expect one question either in oral medicine or in oral surgery. They will give you different TNMs and they will ask you to correctly identify which stage that the tumor is belonging to. Okay. So the same thing they have asked according to AJCC 8th edition staging of oral squamous cell carcinoma. Stage 2 disease will include all of the following TNM classifications. They have given you 4 options. So if you see this, again I have discussed this in my class. So I told you in stage 2, okay, what comes? T2N0M0. This is stage 2. No, they are asking stage 3. Okay. So when we are talking about stage 3, I told you it is any T. Okay. Either T1, T2 or T3 with N1M0, if you can see here. Okay, T1, T2, T3 with M1M0, or it can be T3 with N0M0. Now let us have a look at the options. Let's see the options. Right. So I told you T3 N0M0. We have the same option here, T3 M0M0. Correct? Yes, it's included. Then I told you any T means any T1, T2 or T3. See T1, T2, okay, with N1M0. Okay, so N1M0. So T2 N1M0, T1 N1M0. So the answer is 1, 2 and 3. T4 N0M0, and when T3 changes to T4, it comes into stage 4. Okay, if you can see here, it comes into stage 4. T4 starts only from stage 4. Right? So the answer is 1, 2 and 3. They are correct. So very, very important for your NEET point of view also I am telling you that TNM staging is a very important thing. Please try to practice, try to write it down on a plain paper so that you remember. You cannot mug up these things. You have to, I told you, genetics and things like this, any classification, any staging that is there, it's always a practice that you have to keep in your mind, that you have to write it down and so that you can remember. So TNM staging is one such thing that you cannot anyways afford to forget. Next one. During surgical management of a salivary gland malignancy, resection of the involved nerve and its bony canal is required. So they are saying they have to resect the nerve also and the canal also due to extensive perineural spread of the tumor. Okay. So which of the following demonstrates this pattern of invention? So I told you in the class, among the salivary gland malignancies, I told you the perineural spread. If you can see here, perineural spread is very, very commonly seen with adenoid cystic carcinoma. Okay. It spreads very fast, okay, and its prognosis becomes very worse because of the effect of perineural spread. Even your mucoepidermoid carcinoma also shows perineural spread, but comparatively adenoid cystic carcinoma has more propensity to show perineural spread compared to mucoepidermoid carcinoma, right? So they are saying which commonly has this pattern of invasion. Your answer will be adenoid cystic carcinoma. Some people also told me that, ma'am, along with this one more question, or as a part of this question, we got this Swiss cheese appearance. I don't know whether it was a histological picture that was given to you similar to what I am seeing here. Okay, whether this was given. I told you this is a Swiss cheese pattern. Okay, or cribriform pattern that we see in adenoid cystic carcinoma. If the same thing was given, or they have just given a part of the question saying that Swiss cheese appearance is seen on the histopathology, which is the most common diagnosis. Either of it, your answer will be adenoid cystic carcinoma. Next one. 25-year-old patient presents with a painless swelling in the anterior mandible. Okay, now the spelling is painless. I see a huge description of histopathology. Okay, what are they saying? Histopathology shows rosette-like epithelial arrangements, duct-like structures surrounded by eosinophilic hyaline ring. Ringing a bell? Is this ringing a bell? So when we were discussing our odontogenic cysts and tumors, I told you in the histopathologically very clearly I showed you hyaline ring. See, it's the same thing. Okay. So this is taken from the smart video. Where do you see the presence of hyaline ring? Yes, your answer is adenomatoid odontogenic tumor. So you have when I see the rest part of the question, there is columnar cells with reverse nuclear polarity, polygonal epithelial cells forming world's nests. Which is the most common among the given options which will have this pattern of hyaline ring presentation in the histopath? Answer is AOT. So this again histopathological features. Okay, this is taken from Schaefer's. So let us see. It is very important for us to see, because nowadays I have seen that quite frequently he is giving you a description of histopath, or he will give you 4 statements from the histopath, probably just picked up from the book, and they will ask you which of the following is not true. So for us it is very important to know, at least for important cysts and tumors, it is very important for us to know the description that is given in the book as such. So let us have a look at it. So if you see, AOT exhibits diverse hystomorphological features. It is made up of simple spindle cuboidal columnar cells in variety of patterns, like we have duct-like structures, we have eosinophilic material, we have some calcifications also. Okay. Then he is saying cytological atypia is not a prominent feature. Although not present in all tumors, most distinctive microscopic feature of AOT, same thing that is given here, is duct-like structures, okay, lined by single layer of cuboidal columnar epithelial cells polarized away from the lumen. Is it ringing a bell? If you see here, same things he has given in the description. Okay, so that is why it's important for us to at least read up important histopathological features from the book. These duct or microcystic lumina are lined by an eosinophilic rim. This is called as a hyaline ring. Okay, so very important, AOT. Okay, very clear. I think everybody is able to associate and recollect. Okay, next one, very simple question. Which of the following microorganisms is associated with the development of gastric mucosa associated lymphoid tissue lymphoma? Among the given options, it's very clear that H. pylori, multiple times we have discussed, it is associated with mild lymphomas. Okay, very simple, straightforward question. In a genetics from general path, I think 3 or 4 questions came. So it's genetics has been a very important topic from which I think quite a few questions have been asked in INICET. So let us see a few questions on genetics that they have asked. In a pedigree showing a genetic disorder with incomplete penetrance, okay, which of the following patterns is most likely observed? Now, for us to know what is incomplete penetrance, before we go into the multiple statements, what is incomplete penetrance means? The individual will have the genotype, they will have the genes to cause the disease, okay, but symptoms will not appear, okay. So suppose if I am having bald hair, okay, if I have a gene for bald hair, I have the gene for bald hair, but because of some incomplete penetrance, there is something that is happening in the genetic constitution of the patient, that in spite of having a gene which can cause the disease, that patient is not having any symptoms or no phenotype, that is called as no phenotypic presentation, okay. So this is called as incomplete penetrance. Okay, so when you have the genotype but there is no phenotypic expression of that particular disease, it is called as incomplete penetrance. Okay, Now, with respect to incomplete penetrance, they are asking a few questions. Which is most commonly associated with incomplete penetrance? That is the doubt that they have. First one, the disorder is expressed in every generation without exception. I told you phenotypic expression only will not be there. So, in every generation you cannot expect the genetic disease to be expressed. So, that is ruled out. Okay. Next one, the disorder may skip some generations with some carriers unaffected. Yes. Because of this incomplete penetrance and no phenotypic expression, there will definitely be some skip generation. So, this is correct. All members are affected? Again, no. Disorder occurs only in males. If it is only in males, it is sex linked. Right? It cannot be incomplete penetrance. So, among the given options, the best option that is suiting our incomplete penetrance is you will have skipped generations because of some genetic defect where the phenotypic expression is not occurring. So, all the individuals may not be affected. There can be some skipped generations. So, among the given options, I think the option B is going very clearly as the correct statement with respect to the question that they have asked us here. I hope everybody got this. Okay. Next question pertaining to genetics. They have given if both the parents are carriers for beta thalassemia trait. Now, none of them is expressing the disease. They are carriers. What is the expected outcome for half of their offspring? So, they are asking 50% of offspring, what happens to them? Okay. So, we have to draw the genetic module constitution and then we have to see how it is happening. So, if we see here recessive inheritance, okay, taken from our genetics part video. So, if both father and the mother are carrier, if you see here, both father and the mother are carrier, similar to what we have seen, they will have just one gene representative of that disease. So, how much population is affected? If you see, 25% population is affected. Okay. How much is normal? 25% is normal. Right? When we talk about carriers, if you see here, how many are carriers? 50% population is carriers. Okay. So, if both male and female, that is the father and the mother are carriers for beta thalassemia trait, the percentage of having carriers in the expected offspring is also 50%. So, what will be the correct answer? 50% risk of having thalassemia major. They are not talking about major. So, it's wrong. 50% risk of being completely normal. Completely normal, we have 25%. Okay. 50% risk of being a carrier. Yes, this is a correct answer. 50% risk of having thalassemia intermedia. Thalassemia intermedia is similar to beta thalassemia trait, but the symptoms are more severe. Okay. And symptoms are more severe, something that is more commonly towards beta thalassemia major. Okay. So, this is also not correct. So, 50% of risk of having beta thalassemia minor and being a carrier in that is the correct answer. Okay. So, 25% normal, 25% unaffected and 50% unaffected, 25% normal and 25% affected. This is how the recessive inheritance genetic pattern goes about. I think this is very, very clear. Next is a very, very simple question. Most frequently occurring opportunistic oral infection in patients who are immunosuppressive or those who receive antibiotics or corticosteroids. Okay. So, most common infection, yes, very, very easy. No need to go to the options also. Close your eyes and answer Candida. So, we have already covered this multiple times in our question bank. So, which of the following is an opportunistic fungal infection? We have discussed Candida. And also apart from that, yes, if a patient comes with red ball tongue, atrophy of filiform papillae, okay, with a burning manifestation, with a history of long-term antibiotic use, again the answer is Candida. So, we are done with part 2 recall of INICET November 2025. I'll see you all in part 3 recall. We are trying our level best to collect a lot of questions from everyone. If you have a few questions which you are confused with, which you want to send to our team, you can always drop a comment in the comment section given below. Okay, try to follow our page, hit the bell icon if you like our content, and keep us posted. Try to share as much as possible so that everybody is benefited from this session. Thank you so much. Stay tuned.